evening, where he maintains an apartment. His apartment is located on the first floor of this particular building. This building does not have an elevator. I share that with you because that's important from a medical investigation perspective. This individual has no school-age children, and while in Fort Lee, and I repeat and underscore, while in Fort Lee, this individual had no known contact with any other individuals. So while in Fort Lee, Monday evening, he had no known contact with any other individuals. We've confirmed that he did not travel to a level 3 country. That would include China, Iran, Italy, and South Korea. And I just want to remind everyone that this investigation is still ongoing, and we are working closely with our healthcare partners to ensure that everyone is safe and all reasonable precautions are being taken. The issue is not over. The investigation will continue. We continue to monitor the situation and follow the protocols that have been provided to us by the state of New Jersey, for which we are very grateful, and of course local health departments, and also of course the Bergen County Health Department. I will tell you, and I want to be clear about this, that Fort Lee is open for business. We're continuing to conduct our lives the same way we conducted them yesterday. Any and all events that were on the schedule, whether it's basketball games, whether it's meetings at the library or what have you, that will continue. There are no scheduled cancellations because there's no need for any scheduled cancellations. Again, Fort Lee is open for business. I also want to remind all Fort Lee residents and everyone that's hearing this press conference that it's flu season. Lieutenant Governor Oliver pointed this out, that, were you to contract flu-like symptoms, don't immediately think it's the coronavirus, because there's the very high likelihood that it is a common flu. However, if and when you do have these symptoms, be smart and follow the Center for Disease Control recommendations, which we'll get into in a second. As the Commissioner of Health pointed out in the press conference earlier, the coronavirus health risk to residents in New Jersey and likewise in the borough of Fort Lee remains low. I also want to point out and cannot stress enough that there should be no stigma whatsoever associated with this virus, and it affects people of all gender, of all race, and of all religion. If there are any acts of bias whatsoever, they are to be reported to our police department. You are to report it via 911, and immediate action will be taken. This case, as far as we know, as of this moment, is not linked to any other cases that we are aware of, which is also important to note. I also want to underscore that everyone in Fort Lee and elsewhere must remain vigilant. The issue doesn't end today because the investigation, the preliminary investigation, was concluded. We need to remain vigilant and follow the Center for Disease Control precautions, and that includes covering your mouth, sneeze or cough into a tissue or your sleeve. Make sure you dispose of the tissue in the trash. Stay home if you are sick and not feeling well. If you don't feel well, call ahead to a doctor or clinic before you arrive. Continue to routinely clean and disinfect frequently touched surfaces. Continue to wash your hands frequently for at least 20 seconds with soap and water. If you're using a hand sanitizer, make sure it contains at least 60% alcohol. It is critically important that folks remain knowledgeable. They refer to the websites that we've been directing all residents to, and together we will get through all of this. But again, I just want to confirm that while this individual was in Fort Lee, there was no known contact with any other individuals. And again, I want to extend my appreciation for our preparedness. This task force was convened weeks ago in light of our proximity to New York and the characteristics of our beautiful community. We sort of kind of knew this was coming, and we anticipated it, and we responded accordingly. And I'm proud the way Fort Lee performed today. And I can't begin to thank Executive Tedesco for being with us every step of the way. And I failed to also recognize Bergen County OEM, who also has their representative here today, who was also very, very helpful. At this point, Jim, do you have anything you'd like to add?
On behalf of the county, while I've been here all day with the Mayor Sokolich, there are other things going on in Bergen County. You heard the health commissioner and the acting governor confirm of the second presumptive case in the state of New Jersey. And that is now something that will be looked at by the State Health Department, and information will come out from the State Health Department. We also here in Bergen County have people that are in self-quarantine, and that is through either they had received a letter from the state of New York in regards to being in New Rochelle, or they're listening to what we're telling them because of the way they feel, and they are self-quarantining, being self-quarantined. The folks here, because it started on Monday, they now have a 14-day period here to make sure that nothing else develops. But that is the protocol. Once it's identified, from that day, the quarantine stays in effect for 14 days. If somebody else is identified, as we have the second person, wherever that person is from, that quarantine will start from the day through 14 days. I anticipate, with a county of 1 million people and hundreds of thousands of people that travel through Bergen County, I anticipate to have more positive identifications for this virus. As I said Monday when I held the press conference, and one of the folks that is standing here said to me, "Jimmy, why are we doing this? Why are we being prepared?" And I appreciate him asking that question. This is the reason why. This is exactly the reason why. How well Fort Lee was prepared, how well Bergen County is prepared, how well the state of New Jersey is prepared. But make no mistake about this, this will continue to grow, and we will be prepared for it. The good thing is, 2 people so far, presumptive, and almost 9 million that live here in the state of New Jersey. So as the mayor said, the likelihood of contracting COVID-19 is very low. But that doesn't mean that we don't prepare. It doesn't mean that we're not going to be vigilant. And as the days go on, my sense is we'll be back in front of you talking to you about some others, but know that we're going to be prepared to deal with that. I had given an update the other day in regards to the school system in Bergen County, and that continues to be open, but we've restricted travel for any student that goes to a Bergen County school. They have canceled all their traveling overseas at this point. The state of New Jersey, as you just heard from Lieutenant Oliver, they have restricted travel overseas and also to any states that have a large outbreak. We will be reviewing that from a county standpoint to see whether we are going to follow the lead. My sense is if the state's going to do it, we will probably follow their lead in that also. So, Mayor, thank you.
Thank you. Thank you, Mr. Executive. And I think it's also important to point out that once there was the presumptive case that we learned of last evening, the next critical step, of course, is the medical investigation that our health officer conducted and performed this morning once she was allowed to perform it. And we appreciate that effort because that's the telltale. During the course of this entire day, your mind wanders. We were preparing for worst-case scenarios. We were preparing for high rises. We were preparing for schools. We were preparing for all of that. And fortunately, we were able to, or the circumstances confirmed that we're not required to deal with any of that. But as the executive points out, we are going to remain ready here, and we are going to make sure our residents are safe. And there's something that I want to underscore. Any acts of bias, they need to be reported immediately, and Chief Hinsey has been directed to respond and investigate those claims as expeditiously as conceivably possible. And I just want to conclude before I take questions. Fort Lee is open for business. We have games going on. We have things that we're dealing with. Our families are going to continue to lead their lives. I also want to thank my residents for their patience during the course of the day. rather than rush to judgment and get information out there, because I will tell you, there were rumors abound as of this morning, none of which turned out to be true. That's why we wait for the investigation, we wait for CDC confirmation, we wait for the appropriate state agencies to make sure that the investigation is confirmed, and then we release it, as opposed to putting false information out there. I too would have loved to have had that conversation very early, but it wasn't confirmed, and I'm grateful that we didn't, because you would have gotten false information this morning before the investigation was concluded, and that's not acceptable. So with that, questions?
Mayor,
Brian.
because this is asymmetric, have you been able to determine that this 32-year-old, because I read 30 of the news.
30s, but around early 30s, yeah.
Early 30s man, has not been in Fort Lee over the previous 14 days, or has he come here perhaps carrying this virus and gone to a restaurant or whatever?
You know, obviously, probably the second or third question after name, occupation, and address is talk to us about your travels, where you've been and where you haven't been. Our investigation at this juncture has confirmed that one isolated evening, Monday evening, this past Monday, was his appearance here in Fort Lee. His apartment is on the first floor, no elevator, and based on that interview, we've confirmed that there were no known contacts. Again, I want to underscore, while in Fort Lee.
For the previous 14 days.
For the previous 14 days. It included that entire period. Sir, sir.
Let me just ask Mr.
You're next.
We're understanding there's a second presumptive case, maybe in Englewood. Is that what you're hearing?
So I have no knowledge of where the second presumptive case is from. That I have no information. We will be notified by the state as to where that is, and the local health officer and/or the county health officer, if it's in Bergen County, will be notified. But I've not been told that that is in Bergen County, nor do I know where it is. No.
Since this man lives in New York, are you in contact with authorities in New York? And now, are they now taking over and tracing his steps in the last 14 days? And also, at the the lieutenant governor's press conference, they mentioned he went to an urgent care as well. So maybe he did have some other contacts.
So the answer to your first question was, are you in contact with New York? Yes, the state health department is in contact with the state of New York. They've already spoken with the state of New York. There's been a dialogue back and forth about that. We've given them the information we have. They now start an investigation on their side to find out what travels and what contact he had in New York. That information will all be shared back and forth. In regards to the statements from the governor, the acting governor, lieutenant governor, and the health commissioner, I'm not at liberty to comment on any of that. I don't know any of that, so that's not something that I can add anything to.
How many are self-quarantining? How many are self-quarantining?
So I don't have that exact number, and I won't, because many people are self-quarantining themselves based on the way they feel. That's what we're asking them to do. I do know that we have been told by the state of New York that we do have Bergen County residents that were identified to have had contact with those from the New Rochelle incident, and those people are self-quarantined here in Bergen County. That number I don't know.
So are there any other people that you're aware of, besides those who've been contacted by New York authorities? Any other people here in Bergen County who are self-quarantining?
No, I don't. I'm not aware of it. I haven't been in the office all day, so my health officer may have more of that information. I'm aware of the ones that we were notified through the state of New York for Bergen County.
So those people got letters home? Were they called? How did?
Multiple ways.
And you said, I'm sorry, but you said the gentleman who has been preliminarily confirmed to have COVID-19, you said he was a healthcare worker, and so was he here Monday night in anticipation of going to work Tuesday and he fell ill, or how did that work, and did he go to work?
So the person was in New York throughout the weekend, and Monday went to work, didn't feel well, and then came home here to his residence in Fort Lee, and still didn't feel well, and then went and sought treatment.
Does he work here or in New York?
I'm sorry?
Does he work in Jersey or New York?
He's a healthcare worker in New York.
And do we know what urgent care he might have gone to, or is that?
Again, that was released by the governor, the governor and the health commissioner. So I'm not aware of that location.
Do you know if that's in Jersey or New York? I mean, do you have any idea?
I can't confirm the location in either place. If it's in New Jersey, then we'll be working with that location to ensure what contacts may have taken place there.
Is he a New York City resident? Is he a New York City resident, or does he live outside of the city? Is he a New York City?
I don't know his official residency.
Or where does he mainly live with his family?
His family is still in New York, and he was here by himself.
How much time lapsed between when he started feeling ill, the symptoms, to when he was brought into isolation? How many hours?
And how many people was he in contact with?
Because I
Well-
mean, it's Monday evening, but.
I'm sorry.
That's right. So, from a standpoint of when we believe that he started to feel ill on Sunday, and that come Monday, he came to New Jersey and felt ill here again in New Jersey, and then sought treatment. In regards to any contact, the mayor was very explicit about that. There's been no known contact here with anyone in Fort Lee.
What are the state and local authorities' testing capabilities? How many people are you testing each day or each week?
So you would need to ask the state that.
How many people is Bergen County testing?
Bergen County cannot test. There's only one place in the state of New Jersey that can test, and that's the state.
Jim, can you confirm for us that we're to assume this gentleman drove instead of taking mass transit to New Jersey? If you say he came in contact with no one?
So he used his own private transportation.
So to be clear, he works in the city.
Correct.
He said.
Correct.
His family's in the city.
Correct.
Do you know what the Fort Lee link is? Why Fort
He
Lee?
has an apartment here.
Do you know why?
Well, aside from that, we're an incredible, wonderful community to live in.
There you go.
I'm pretty sure that Fort Lee is one of the most enviable places to live in. I guess I made that point clear twice now. I don't know what the exact reason why he maintains that apartment there. A lot of folks do that, by the way, here in Fort Lee. You know, the hustle and bustle of the city, sometimes it's just easier to get to, whatever. I don't know if we have that information.
And to be honest with you, from our standpoint, it doesn't matter. Right? Why he lives here, why he was visiting here. We know that he did, and based on that, it's the health officer's responsibility to track his movements. That interview was done, and it proved that in Fort Lee, there was no contact with anyone in Fort Lee.
So he came to Fort Lee.
Do we know the hospital that he worked on in New York? I mean, do we know?
No, that we don't have the information on.
He came to Fort Lee. He felt sick in Fort Lee, but you don't know if he went to an urgent care in Fort Lee.
I can't tell you, I know based on what the governor and the health commissioner said in regards to he sought treatment at a facility prior to going to the hospital.
Would they normally tell you, I don't want to say normally, but do you expect they would tell you if he went to an urgent care here?
So yes, we know that it wasn't in Fort Lee, otherwise that would be still part of the investigation. So it was not in Fort Lee.
Or Bergen? Do you know
What?
Do you know if it was elsewhere in Bergen?
No, the only thing I could officially say is that based on the interview, he did not go anywhere else in Fort Lee.
But what about an urgent care? I mean, the county's big. There could have been an urgent care elsewhere. Do you know where the urgent care is?
I'm not aware of that, no. Okay, Mayor?
Thank you. Any other questions other than, again, Fort Lee's open for business, and I told you folks this during the course of the day. your reporting and getting this information out is critically important to us, so thank you, and we're appreciative of the media in this regard, and I mean that. And again, Fort Lee, a huge thanks to our county executive. Jimmy, thank you, and to everybody on the task force and to the state of New Jersey. Goodbye, good luck, God bless Fort Lee.